the webinar. You can see us and hear us, but we can't see you or hear you. We can take your questions via the Q&A chat box at the bottom of your screen. So feel free to start typing in your questions now. We'll get to the Q&A session in a couple of minutes, but you can start sending in your questions now and we can see what you're interested in hearing about. Before we get started with our Q&A session and introducing our panelists, I wanted to just play a short welcome video from our university president, Dr. Michael Crow, who just wanted to say a few words about the learning environment that we're creating for the fall semester and the positive experience we hope each of you will have when you return to campus. He apologizes that he couldn't be here in person, but he did record a short video message. So if we could play that.
Can everybody hear me all right?
Yep, we can hear you.
Okay, great. So what I'd like to do first is welcome you to Arizona State University and to being a Sun Devil. We're excited that you're on your way to ASU, that you're going to become a part of America's most innovative university, a university deeply committed to inclusivity, deeply committed to research that matters, and deeply committed to, as our charter states, to the success and well-being of our communities on every level: economic, social, cultural, health and well-being, all things. And so you can imagine the last few months for us have been rather unusual. But for us, unusual means what can we learn? How can we adapt? How can we adjust? And so in March of 2020, we couldn't operate the university in 3 simultaneous teaching and learning modalities. And in June of 2020, we can. We take from our tradition in ASU of high-speed innovation, high-speed intellectual innovation, high-speed technological innovation, high-speed evolution of the institution. And we took all of that as we encountered COVID, and we developed a third way to teach and learn. Our core way is what we call the full immersion on-campus technology-enhanced learning environment. 75,000 students on our 4 campuses, 5,000 faculty members, give or take, all compressed together, 25,000 support staff, 100,000 people learning in one of the most intensive learning environments that humans have ever created, hundreds of degree programs, thousands of ways for you to advance, a way for you to plot your own course. So we've been building that and nurturing that and really greatly enhancing that the last 15 or 20 years. And we're very proud of what we have in that full immersion on-campus learning environment. And then the last 10 years or so, we've been advancing technologically into what we call digital immersion, online learning for students that went to college and weren't able to finish in the past, or people that are in the military and things like this. And so in that arena, we learned a lot. And then so along comes COVID-19, and we found a way to rapidly, almost instantly, create a third way of learning, what we call ASU Sync, which is full immersion, face-to-face learning, live learning, interacting with us. And so as we open for the fall semester, our plan is as follows. We will be fully prepared with every technological tool that humans have, in fact, those that we've invented ourselves, a fully licensed new sampling technique for COVID, for self-sampling through saliva, high-speed robots that we've built, designed, and deployed over the last few months on testing for COVID, as well as new learning platforms, new learning facilities, new ways to enhance learning so that we can shape and build for our on-campus environment, a place to be where learning can be intensive and health and safety can be maximized. And then as a part of that, from what we learned in the last semester, and I think that this is important, we're building into all 900 of our classrooms the ability for a student to zoom in, to be live present, like television, to be live present in any classroom for any class anywhere within the entire comprehensive course portfolio of the university. And so what we mean by that then is that we're going to be able to operate the university in whatever level of health management and safety management that's necessary to ensure your health and safety and to ensure the health and safety of our staff. We are deploying those systems as we speak. We're confident that these can work. And we're even more confident that what we found and what we've come across is a new way to enhance teaching and learning. We're going to be taking our most elaborate in a sense, think of them as robot-based tools, or tools that are what we call adaptive learning tools, ways to enhance learning. We're going to be moving those in from our online programs. We're going to be taking our ASU Sync technology and making that available to students that are fully immersed on campus. So we may have students in a class, if we have to be socially distanced, where you're in one class physically and then one class Zooming, and then you switch over time. And so, but you'll have access to the faculty, access to the teaching assistants, access to everything that we've got going on. And so we're very excited about then being able to create then for the students on campus like yourselves, a fully immersive, technologically enhanced, technologically empowered learning environment, matching that with the unbelievable work that we've been able to do with the Mayo Clinic as our partner, with other companies that we've been working with to build personal health and safety apps, to build our testing technology, our sampling technology. And so we are excited about being able to reassemble for the fall semester in early August, starting classes around August 20th. We're excited about being able to move through and make things happen for you. We're excited that you're going to be able to engage our thousands of faculty members and tens of thousands of support personnel, full library, full assets, full services, but all in the context of socially distanced and technologically empowered. Our confidence that this works is very high. We successfully navigated the last part of the spring semester. We're ready. We're navigating right now the summer session with tens of thousands of students in both our sync mode and our online mode. So we're in fact very excited about the possibilities. Now, there are innumerable reasons that coming to campus is really, really important, and it's a part of the total social experience, if you will, the total immersion, what we call immersive experience on campus. And that immersive experience will be present. Students will be working in teams. Students will be living together. Students will be healthy and safe together because of our testing regimen, because of our support, because of our training, because of the world-class assets that we have to just make this whole thing work. And so we're excited about the opening of the fall semester. I'm excited about the panel and that you're joining us today in this session to be able to get your questions answered and so forth. And so I don't.
All right, thank you, Dr. Crow. I'd now like to go ahead and introduce our panelists, each of whom has responsibility for different parts of your learning experience and maintaining a healthy campus environment. Let's start with Jocelyn, who is our student panelist joining us today. Jocelyn?
Hi, everyone. My name is Jocelyn. I am now a third-year student, or a rising third-year student. I lived on campus for 2 years, and I'm going to live on campus again. My major is sociology with minors in family human development and social welfare. Some things I'm involved in is mostly through work on campus. I work for new student programs as an orientation leader and as a team lead, but I'm also involved in Barrett First Gens because I am a first generation student. And I'm also in the Honors College. Yeah, and I think that's about it for me.
Thank you, Jocelyn. Thanks for joining us today. Next, I'd like to introduce Dr. Cassandra Aska.
Hello, everybody. Cassandra Aska, Deputy Vice President and Dean of Students on the Tempe campus. Looking forward to having you all back at the university this fall.
Next, I'd like to introduce Dr. Fred Corey.
Hello, everyone. My name is Frederick Corey, and I am the Vice Provost for Undergraduate Education.
Following Fred is Dr. Sequant Jaj.
Hi there, I'm Sequant Jaj, Vice Provost for Academic Innovation and Student Achievement. Looking forward to answering your questions about ASU Sync and the fall. Thank you.
Next, we have Rudy Bellavia.
Hi, everyone. My name is Rudy Bellavia. I'm Managing Director for the Office of Business and Finance, and we oversee a lot of the business operations for the university, and I look forward to answering your questions.
Next is Dr. Joanne Vogel.
Hello, I'm Joanne Vogel. I serve as the Vice President of Student Services. Very excited to welcome you all back, and I'm here today to focus on answering your questions related to health and well-being and whatever else is on your mind.
And last but not least, Dr. Libby Wentz.
Hi, I'm Libby Wentz, and I am the Vice Provost and Dean of the Graduate College. So for any of you who are graduate students or even aspiring graduate students, I'm happy to answer your questions.
Thank you. So there are three main areas that we want to cover with you today in our hour together. The first is we want to spend some time talking about how you will learn. What is your classroom environment going to look like this fall? The second area is your health and wellness. What are your testing options going to be? What are requirements for face masks and social distancing? The third item that we want to spend some time talking about is just campus life in general. What are events going to look like? How are you going to interact with your friends and your peers? What is residential living going to look like? So we'll spend about 15 minutes talking about each of those topics. And then at the very end, we'll reserve a couple of minutes to take questions that we weren't able to cover under those items. A little bit I wanted to say up front about how you will learn, if we could advance to the next slide. Our goal is to provide a quality learning environment that adheres to public health and safety guidelines from the U.S. Centers for Disease Control and Prevention. And so, as you all know, all of this work started in mid-March when COVID-19 really sort of emerged on the scene, and we had to adjust our operations. And we have been really in lockstep with the CDC and local public health officials about how to operate our environment moving forward. Many classes will include a blend of in-person and ASU Sync experiences. And so if you're a returning student, you're familiar with the ASU Sync experience. Now you're going to be having a little bit of both. And you will hear from your professors in a couple of weeks exactly about how they are going to teach your individual classes, and details for those classes can be found on your My ASU My Classes tab. The other item I just wanted to give a little preview of is what we're doing on campus to maintain your health and wellness. If we could advance to the next slide. Again, if you're a returning student, you should have received the message now that face coverings will be required in all ASU buildings and outdoor community spaces when social distancing measures cannot be followed. And so examples of outdoor community spaces include sidewalks and bicycle racks and parking garages, and again, places where you're around a lot of people and you just can't get those 6 feet apart. All on-campus students will receive what we're calling a community of care kit. It's going to contain face coverings, a thermometer, hand sanitizer, and other items that you can use to help maintain your health and wellness while you're on campus. Students who need it and employees will have access to COVID-19 testing. And we have a longstanding partnership with the Mayo Clinic, and through that partnership, we are launching what we call the Health Check Health Status Verification Platform, which will be available to you through the ASU mobile app. Last item I just wanted to spend a couple of minutes talking about is just life on campus in general. If we could advance to the next slide. So all of our student services will be available to you either in person or in a digital environment. And again, if you're a returning student and you were with us during the spring semester, hopefully you were able to access all of the services you needed in the digital environment. For dining, we are maintaining a takeout dining experience. We'll have prepackaged disposable utensils, and we're making some changes to our dining halls, including touchless payments, physical distancing measures in lines. We'll have sneeze guards, and we will have extended hours so that students have a little more flexibility in terms of when they can go and get their food. Just a little bit about sort of the cleanliness on campus. All of our ASU buildings, residence halls, and classrooms will receive a thorough cleaning with medical grade products, followed by a fogging system cleanse prior to occupancy this fall. And then during the semester, all buildings will receive a thorough cleaning once per day, and high touch surfaces will be cleaned twice daily. So that's just a little bit of an overview about the three areas that we want to spend some time talking about today. I will now start to take some questions on our learning environment for this fall. And so let me just see what we've got here. Okay, our first question, will we have the opportunity to rely solely on Zoom or Sync, ASU Sync, for all courses? Dr. Corey, do you want to take that one?
Absolutely. In most cases, yes. There will be a very few select number of courses, particularly in the sciences and the fine and performing arts, where in-person attendance will be required. And there will be a class note on the section number that says in-person attendance is required. So look on your schedule and look at the class notes and see if that note appears on any of those classes. Otherwise, students will have the option of attending class in person or attending via Zoom.
Thank you, Dr. Corey. Another question from our audience: fall break has been removed. What about Thanksgiving break? Does this mean classes will end earlier, or a student can go online after break? Do you want to talk about the schedule, Dr. Corey?
Sure. The schedule remains the same with the exception of fall break being canceled. So you definitely will have your Thanksgiving break, and then we have one more week of class and final exams.
Thank you. Another question from our audience: can a student switch if they start in person but need to or want to move to our sync environment during the semester?
I can take that one too.
Great, thank you.
The important part is to be in good communication with the instructor of your course. So if you become ill during the semester, by all means, notify your instructor and make sure your instructor knows, so that you can work through any assignments that come up, and faculty will be as flexible as possible in working with you to make sure you're able to accomplish all of the work you need to accomplish.
Thank you. Our next question is, I read that classes will be at 50% capacity with only one half in person. How will the 50% in person be chosen? Is it a rotation? Dr. Jaj, would you want to take that one?
Sure thing. So a couple of observations following up on what Dr. Corey said. Most classes would have the infrastructure in place to be able to broadcast live video through Zoom. So I think that's something very useful to keep in mind. That means that almost all classes are available in the ASU sync experience. Then coming to your question, for maintaining social distancing, we will divide the class mostly the Monday, Wednesday, Friday classes might be in thirds, Tuesday, Thursday classes might be in halves. It is tied with the total enrollment of the class. My guess is most faculty will choose last names and divide the class based on two halves. One group will attend on one day, while the class is also streamed. As I said, all classes will be streamed, and the other half is able to listen in on that and engage in all the classroom activities through Zoom, through Zoom rooms, etc., and all the other tools we are bringing into the learning environment between now and August. And in the next class session, we'll switch, and the students who were attending the class through the ASU sync modality would be in the class, and the students who were present in the class will be attending via Zoom.
Thank you. Our audience wants to spend a little more time on this subject. They want to understand what criteria we're using to determine if face-to-face classes are actually safe, and what would be the criteria if we needed to go fully to a full remote environment again. Dr. Jaj or Dr. Corey, I see you unmuting. Do you want to take that one?
Sure. So let's take the second part of the question first, and Vice President Vogel might be able to help us out with this too. We are following all of the Centers for Disease Control and Prevention precautions and advisories. So we're monitoring the situation very carefully. As you know, in the middle of spring 2020, we made the crucial decision to switch to completely online remote learning in order to protect the health and safety of you, our students. And if that situation arises in the fall, we will do it again, because we are absolutely interested in your health and your wellness. The first part of the question, can you repeat the first part?
Sure. What criteria are we using to determine if face-to-face classes are safe?
So it is the Centers for Disease Control. And I wonder if Vice President Vogel, if you would chime in on the Centers for Disease Control and Prevention criteria.
Absolutely, and happy to hop in. And so our county medical director, who is also a CDC field officer, is the person that we consult to look at local conditions. And so what is happening, and some of you are probably following if you're out of state or out of county, what is occurring right now in Arizona. And so we are seeing an increase in cases that we will monitor that in the same way we are currently and make the decisions about whether or not to continue in whatever format based upon guidance from the local, from the county medical director.
Great, thank you. Another question about the classroom environment. How will ASU enforce social distancing in the classroom?
We're beginning with the physical space itself. So if there's a room where we're going to be working at 50% capacity of the room. So that means every other seat needs to be empty, right? So you leave a space between you and anybody else around you. And so we'll mark the chairs accordingly so that you will know where it is appropriate to sit. Now, the legitimate question is, because we've all been there, so if I'm a teacher in a class and I see that certain students are ignoring that practice, I would talk with the students and we would talk about why it's important to maintain distance and why it's important to spread out. And so this is going to become a part of our regular classroom maintenance. And the faculty will be working with you on making sure that you follow all of the good health and safety practices that the university has put forward.
Great. Does anyone want to say a little bit more about the mask protocol that will be required in the classroom as well? And then anything about cleaning supplies that will be made available in the bathroom, or I'm sorry, excuse me, in the classroom. Hopefully there's cleaning supplies in the bathrooms too, but classroom specific sort of experience there.
I'm happy to take the face covering because then I can talk about any students who are also residing on campus.
Great.
And so for face coverings in the classroom or inside all ASU buildings, the expectation is that you will wear them at all times. We have figured out how to do dining in the same takeout fashion, so people will not be eating inside the buildings either. They are expected to sort of head out, take out any of our meals and go sit outside or back in your rest hall or in your cars if you're driving home and going to eat. Also, face coverings, as Katie mentioned earlier, will be required in any of those outside community spaces where you will not easily be able to social distance. So think your crosswalks, parking garages, bike racks. The idea behind this is we're creating a community of care to keep each other safe and healthy. And so by me wearing my face covering, I'm keeping you protected, and the same thing in reverse. And so we have committed to not only extending ourselves out on campus, but into our local communities to see if they too will consider adopting what we feel is a really good stance about ensuring health and decreasing transmission. I think there was a question too about maybe how you get your community of care kit I saw floating through there. And so students who are, and I noticed the on-campus terminology caught someone. So students who are going to be on or off campus are able to pick up their community of care kit. We will arrange times at the bookstore is what we're currently contemplating for that. And inside your community of care kit, you will have some starter items to remind you of health. They will be available in the bookstore for replacement if you run out. And then also every student will receive 2 face coverings in their community of care kit to get you started.
Thank you. All right, we are now going to move on to health and safety questions. So our first question is, will I be notified if someone in my class tests positive for COVID-19? Dr. Vogel, do you want to take that one?
Sure. So this is one of the reasons we are putting in place as much social distancing as possible and wearing a face covering. So you are not necessarily going to be notified if there is a positive in your classroom. It is possible that you will be if you have spent enough time in close proximity to that person. So we work in combination with the county to do contact tracing. And if we have any indication of exposure for you and that you might be at risk, we will notify you and then offer you testing, and then also talk to you about what it means to go into self-isolation.
Thank you. And a couple more questions related to that topic. One individual is asking whether or not the class will be moved online for 2 weeks if somebody tests positive in the classroom. And I think the answer is no, but do you want to talk a little bit about that, Dr. Vogel?
Sure. And I think the quick answer is exactly as you said, but we will consider what is needed based upon any circumstance. If we had multiple people that needed to go into self-isolation, if it's a particular type of class where there has been, we hope there's not, but there has been more close contact for any particular reason, then we may have to take some actions. But generally speaking, your answer is absolutely true, would be no.
Great. And then also related, our audience wants to just understand better how our contact tracing program is going to work, and then what measures are in place to protect the identity of individuals who may test positive.
I'm really glad that someone thought about the privacy there in that question of anyone who is testing positive. And so it is important to remember that it should belong to the person who's testing positive to share with other people that has been their experience. And so we will, in the contact tracing, we follow the guidance of the county. We have offered, because we have the ability to work with some of our nursing students, for instance, our counseling students, our social workers, is we've been able to provide them with additional staffing to support the surge in cases locally. So we will be part of and working in coordination with the county to engage in contact tracing. And so for those who are really curious, once a positive case has been identified, there is a lengthy interview that goes into talking to that person about where they've been over the past 14 days, with whom they've been in close contact, for what period of time. And then following that is when the contact tracing occurs, where people who may be at risk because of that exposure would be notified directly and then provided the instructions that I mentioned previously.
Great. And just a note to our audience, I apologize for not mentioning this up top, but obviously we have 60 minutes here and we're answering as many questions as possible through the live format that we're in. But you might have noticed that there's a team of individuals that are responding to some of your questions as they come in. And so I just wanted to note that we've got folks who are tackling questions that don't make it to the live portion, and every question will be answered today. So if we don't get to it through this live stream or through one of our folks who are answering the questions, we will follow up with you. So I just wanted to make that note. We have a question about CARES Act funding, and one individual in our audience said, given Dr. Crow's statement about maximizing student retention, how can we trust health is being prioritized for CARES Act funding? Dr. Vogel, do you want to talk a little bit about what CARES Act funding is intended for and how we're going about utilizing those funds here at the university?
Sure. So the $63.5 million that was allocated to ASU and CARES Act funding, I think it's important to know that all of it, either directly or indirectly, will benefit students. So for the half that is designated to go directly to students, we are still figuring out how we will be distributing that. It's important to know that once we submit that plan to the federal government, then they release the funds back to us. We have prioritized continuing students and students who have demonstrated need. So I did notice one of the questions out there was about, will students who demonstrate more need have more access? And that's quite likely to be the case. We have chosen a strategy that is unlike some of what you have seen at other institutions, where they have taken a number of students, divided the amount, and simply sent a check. I think those of you who think about equitable distribution of funds will realize that doesn't fit that criteria. So we will be looking at how to do this in a way that accounts for need. The other part of that question about health in the CARES Act, so that you know, there are additional monies out there, some of it earmarked specifically for things like telecounseling and telehealth. So in order to preserve those funds I just mentioned that we can use directly, well, this will also directly or indirectly benefit students, but we have applied for additional CARES Act funding to support our health needs specific to telecounseling and telehealth. We don't know if we'll receive it yet, but we have applied.
Great. Well, another question from our audience. Why not keep classes all online to keep people safe this fall semester? Dr. Vogel, Dr. Corey, Dr. Jaj, anybody want to jump in there?
Well, there's something very important about the human interaction that occurs in a classroom. There are discussions, there's a lot of nonverbal communication that occurs, there's a lot of hands-on work. So we don't want to give that up if possible. We want to be able to maintain the human interaction that occurs between the faculty and the students, as well as student to student. So it won't be exactly the same if we're distributing attendance, but the quality of interaction will be present.
Thanks, Dr. Corey. Another question from the audience. Should I go to health services if I'm feeling sick? Dr. Vogel?
Okay, so this is a great message to start getting out or spreading to your friends, please, is if you are feeling ill and you are uncertain what it might be, our preference is that you schedule a telemedicine appointment. And the reason for that is we are scaling back up the breadth of our healthcare services, and we want to be very careful not to have people in the waiting area that might be infectious and then therefore spread unknowingly or unwittingly the COVID-19 virus. And so if you will call in for a telemedicine appointment, we can guide you about how best to arrange sampling and testing with allowing us to control for traffic and have the appointment set up and then get you in discreetly and allow you to do that in a way that minimizes virus transmission.
Great, thank you. What kind of supports are available if a student becomes ill? Again, Dr. Vogel or Dr. Aska?
Sure. So that's a great question, and we definitely want to be aware to understand how we can support our students. So typically what will happen is if the student gives permission, they'll let the Dean of Students office be aware of it. And then we will have one of our team members outreach to the student and be able to learn about what their needs are and then coordinate efforts in order to meet those needs. And so we will even call the student daily while they're going through their isolation or quarantine period. If they're needing to think about food, we will help figure that out with them. And then if they need to get in contact again with health services or connect with their faculty, we will help facilitate that with them. So once we are made aware, we do that wraparound support for the student, drawing upon all of the resources that exist within the university.
Great, thank you. Dr. Vogel, anything you want to add there?
I think that was perfect. Just know that if Dean Aska and the teams at the Dean's of Students office are happy to coordinate and provide you with support and care and refer you to anywhere you need to go.
Great. A question about the community of care training. When will that be available and what will that look like? Dr. Vogel?
Sure. So some of you may remember taking community of care as your onboarding to the university, where we talked about community expectations and behaviors and what we would expect in a place that supports the success of each other and helps to ensure your own success. So we've added some modules to that community of care training. We would like for returning students to take that as well. So we will be sending out a letter, likely under my name, to encourage you strongly to go ahead and take those modules. They will be available to you in July. It will outline what are the expectations around the CDC that we are implementing on campus, and then just a reminder about how to talk to each other if you're worried about the behavior of those around you, if they're not complying with some of the social distancing and face coverings, is how to strike up that conversation to show that you care.
Thank you. I'm going to move to our campus life section right now, but there are still questions coming in about, all of the topics that we're discussing today. So I'll probably jump around a little bit. But one question, and Rudy, I think this is one for you, is about our shuttles. How will the ASU shuttles work, and what will social distancing look like on shuttles?
Sure, happy to take that. So our shuttles will continue to run on schedule in the fall. Everyone will be required to wear face covering on our shuttles. The shuttle staff will be disinfecting all high contact surfaces, including seat belts, seats, handrails, after every trip. Additionally, we will be doing, as Katie mentioned, the fogging system will also be applied on the shuttles. We will block seats for to enable appropriate social distancing. We'll continue to evaluate and make adjustments as needed, and monitor the CDC guidelines as we progress through the summer and into the fall.
Great, thank you. Question about fees for the fitness center. Will there still be fees for the fitness center if I am not on campus? Dr. Vogel, Dr. Aska?
Sure, I can take that. So the quick answer is yes. And in case you hadn't noticed, we do provide all of our services virtually. And so we have been live streaming some of the workouts that might be your favorite. If you are off campus, please know that some of those funds, they're not user fees. And so we know some students don't use those facilities, but they still pay for them whether they're here or not. And then we will certainly hope that you can join with us virtually for nutritional support. We are even doing some virtual training and then participating in any of the classes that are available to you, either live or on demand.
Great. Question about face shields. Will face shields be allowed in lieu of masks? I know the answer is yes. Dr. Vogel, do you want to talk a little bit more about that?
Yeah, so for those who probably aren't looking at everything available right now on your health and safety, as you will see that face shields are an option. We do have them being printed with 3D printers on campus, which is very exciting. So we have been contributing to the supply that's needed at various places around the state and outside of the state. There are also things, clear masks. So for students who may need facial expressions or need to read lips, please alert either the DRC or your faculty member, as we are ordering a supply of not only face shields, but clear masks to make masking less of a burden and certainly to provide more accessibility to students and for their needs in the classroom.
Great, thank you. We're going to jump back to the academic side of the house here for a minute. Question from our audience. I am an out-of-state student. Do you have any recommendations on if I should return to Arizona or take classes remotely? Dr. Corey?
Sure, I would recommend coming back to campus and participating in the educational experience to the fullest extent possible.
Thank you. Anybody want to add anything to that? Okay, another question. In the spring semester, I had a few courses that fell behind significantly and did not complete all their coursework in the syllabi. Is there something in place to avoid this situation in the fall? Dr. Jaj?
Sure thing. So great question. Right now, hundreds of faculty members are supported by over 100 learning designers to redesign their fall courses. So unlike last time where we were making accommodations very, very quickly on the fly, right now we have enough time to design the learning experience for fall. So you should have a well-designed learning experience where we should not experience what you had pointed out.
Great. Another question from one of our international students. I'm an international student. When will I receive more information about if I should attend in person, and what if I can't get my visa in time? Dr. Jaj?
Sure thing. We will continue to communicate with you. And if you want specific information, please reach out to your advisors. But that said, all classes are being designed right now to be ASU Sync classes. And our faculty and our deans are working very closely together to offer some of the core classes that are going to be time zone specific. So you should be able to attend the classes at a time that is far more convenient than having to get up in the middle of the night to attend the ASU class if you are, around the world. So that's one thing I wanted to point out. Secondly, we are also actively working, just in the case you're unable to come here, in having other activities, class support activities, like tutoring center would be expanding its hour and would be offering tutoring support and academic support at times that are convenient to you, or lectures or other activities that enrich the academic experience will be offered in a time zone specific way.
Well, great. Stay on, Dr. Jaj. A follow-up to that. Will the library and tutoring be open and available in person?
Yes, absolutely. All of these, all the tutoring centers as we have them would be available in person They would also offer services just as they have done over spring and summer online, virtually. Same is true for the library. Library will be opening its door. We'll be doing social distancing and other things, but we are going to be welcoming students into the beautiful upgraded library that we have in place. So you're looking forward to your arrival in these spaces in fall.
Thanks. Jocelyn, I'm going to just turn to you and maybe just ask you to talk a little bit about your experience during the spring semester. You obviously, took classes through our ASU Sync, Zoom format, and hopefully, took advantage of some of the services that we offer digitally. And so I just thought it might be nice if you could provide some perspective on your experience and what it will look like for students this fall.
Yeah, for sure. So what I really struggled with when everything went virtual was I felt like a little bit kind of restricted. I wasn't able to raise my hand and ask my question. It kind of took my teacher a little bit more to answer my question just because the chat feature was a little confusing. But I think overall my experience definitely stayed probably the same. I was able to contact my teachers way more than I was in person, just because with the virus, they were all virtual, so they were answering their emails within minutes after I sent them, which was awesome. And I was able to attend their Zoom office hours, and I also used the tutoring center, the writing center. So I used as many resources as I possibly could to just kind of make sure that my grades stayed up to par. But I think all of the resources that were offered, like tutoring being online and virtual, that helped me way more because I was a little bit wary of going in person when it was still in person, but they were offering it online and it was just as helpful. Everything was probably a little bit more helpful with being online just because everyone, the responses were a little bit quicker.
Great, thank you. I'm going to jump back to campus dining and housing. We've got some questions about what will campus dining look like this fall. Dr. Aska, do you want to talk about that?
Sure. So we are going to have all of our dining services available to our students. We will continue the takeout option for individuals. And, we are looking at having our different retails within our different unions across all of our campuses also be open for the takeout option as well. And perhaps Rudy could talk a little bit more about this too, but we are increasing seating outdoors so that students will be able to take their food and go ahead and eat outside. But that is how the dining experience will happen for our students this year. Our pods will continue to be open as well. So if people want to grab snacks or something quick between their classes, that will also be available to our students.
Great, thank you. Rudy, anything you want to add about our outdoor seating?
Sure, I can add a little bit to that. Yeah, we are looking at expanding outdoor seating for the purposes that Dr. Aska just talked about. So people have more of a community environment and some community space that they can share and not be confined to, areas indoors. So that is coming for the fall semester.
Great. Question about move-in. What will move-in look like? Dr. Aska?
Yes, so we are ready to have our students, as you continue to hear, to come back. You will receive communication from our university housing colleagues throughout the month of July to kind of give you specific information. But, people will be able to move in by appointments. So that is one approach that we're taking in order to think critically about social distancing and so forth. And so you'll be getting more of those specific details over the course of the time throughout the month of July.
Great. And then can students still have roommates? What will the housing system look like there?
Yes, our students can continue to have roommates, and no, we are not asking them to wear face coverings in their room. That is their space, that is their home. And so we're believing that our students will have really good conversations with their roommates and be able to be mindful about, creating and making decisions that keeps them safe as well as their roommates safe. So that's something that's important to us, but they will be able to have roommates. At this time, students will be able to obviously be in their residential hall, but we are not having individuals who do not live in the residential hall come into that space.
So no visitors in the residence halls. And what if somebody wants a single room? Are single rooms available?
Yes, single rooms, individuals can make that request, and then that can be discussed as well if that is the option that they're looking for.
Okay, great. Testing question. Will COVID tests be free for students? Dr. Vogel, do you want to take that one?
Sure. So all of our plans for faculty, staff, and students include that we don't want anyone to incur any out-of-pocket costs. And so if you are a student looking for testing, I encourage you to call ASU Health Services, and they can tell you if you're not in state currently, what might be options to you if you're looking for a test wherever you live right now. Or if you're back with us, is especially if you're symptomatic or have been exposed, we want you to get tested right away. We have other students who will be required to engage in a testing regimen. A good example of that is our student athletes. And then we will also make available to you, as we're talking about without cost, to have testing available to you if you need it.
Thank you, Dr. Vogel. Just a note on time, we've got about 12 minutes left in our webinar, so keep the questions coming. We'll get to as many as we can in our time remaining. Back to you, Dr. Vogel, for a question about ASU Health Services. How will ASU Health Services expand to cope and deal with a potential surge on campus of COVID-19?
Yeah, so we've made all of those plans already, and we have reached out to our colleagues in the School of Nursing, for instance, and asked about their ability to come and assist us if we needed surge capacity. We also have a lot of people that, as needed, that we have contracted with at any point in time where we've had an uptick of something, the flu or any other issue that requires us to go to our contracted providers. And so we've put plans in place that if we do have an intensive need, where we will go and seek additional support.
Thank you. I also just wanted to note to our student audience and our family audience out there that we do have the Dean of the Graduate College here. So if there are any graduate students out there that have questions, specific to their experience and their academic journey, Dr. Wentz is here to answer those. So send them our way. I'm getting a lot of questions about events on campus for the fall. Will there be events on campus, and will there be athletic events on campus? Dr. Aska, do you want to take that one?
Absolutely. So we are monitoring everything closely. So right now, the CDC guidelines say no more than 10 people in a gathering space, but we're monitoring that closely in order to make the best informed decisions about our different events and activities. But I'm really proud to tell you all, and I think hopefully our students who are participating has seen this for themselves. Our student organizations are still very much active. They're having meetings utilizing the virtual platform. They're doing different events and activities through the virtual platform. Our fraternity and sorority life has already opened up their recruitment season. And so that information is also available for our students to begin to participate in. So while we are continuing to monitor how much in-person activity we're going to be able to have, that's not going to diminish the fact that there still will be virtual experiences. Hopefully, many of you either heard of or participated in the Jason Derulo concert that happened a couple of weeks ago. So again, we're staying on that path of being innovative and thinking intentionally about what those experiences will look like with you as continuing students this fall.
Thank you. We're also still seeing a lot of questions about Thanksgiving break from our viewers. Dr. Corey, can you just talk a little bit more about Thanksgiving break, and what are your recommendations related to travel around Thanksgiving?
Well, Thanksgiving is a very important holiday, and we would certainly encourage students to spend Thanksgiving with their families, and maintaining all of the safe practices you have maintained during the fall semester while at ASU. So when you're in public, wear your facial coverings, engage in distancing practices. If you're feeling not well, make sure you stay inside. So we encourage people to spend quality time with their families. They return to campus. We're assuming that there will be no spike in the virus, and that we will be able to resume normal activities after Thanksgiving. If things change, if we decide that there are risk factors, then we want to remain agile so that we are able to go remote after Thanksgiving if needed. But the plan right now is to assume everything will be under control and will be here functioning after Thanksgiving. Dr. Vogel, did I miss anything there? Was that okay from your perspective?
I think you said it well. I think maybe important for those listening to know that we are, as you said it, monitoring the conditions, and others have said it on the Zoom. And so making sure that if we need to adjust our planning, that we will do that. But that for now, it's exactly as Dr. Corey mentioned.
Great, thank you. A couple questions about communication. So some of our viewers are wondering where they can find more information as the semester gets closer, and how is ASU going to communicate updates with students and their families? Does anyone have recommendations on where to go for the latest and greatest information? Dr. Corey, Dr. Vogel, Dr. Aska?
Well, the FAQ page is being updated on a regular basis. So that is not a site to read once and never again. That it's a good idea to keep that page in your bookmarks, and it's where all of our most current information is being posted.
Great. So hopefully everybody also has visited asu.edu/fall 2020, which outlines all of our plans for the fall semester. And from there, you can also get to the FAQ document that Dr. Corey mentioned. And we always, do our best to communicate via email, through my ASU. We use Sunny, our chat bot. So hopefully through all of those different mechanisms, you're getting the information that you need. But if for some reason you're not, raise your hand, send us an email. We've got on our fall 2020 webpage, we've got a list of email addresses that you can utilize to send your questions in. We want to make sure that we're getting your questions answered. We've got a question about mask enforcement. How is ASU going to be enforcing the wearing of face masks? Dr. Vogel, do you want to take that one?
Sure. So first off, we're going to approach you in a kind and caring manner and assume maybe you just forgot. And so looking at, do you need to go find a face covering? There are some buildings that have some disposable masks. We're going to try to provide some to faculty. We don't wish for that to be your excuse to forget your face covering because we may not be able to accommodate everyone if that were to be the case. If there's a pattern of face covering non-use, we'll say, then we will address it through other ways. Our student code of conduct does speak to reasonable requests or orders from university officials, and we feel that this is a reasonable request or order because we are protecting each other's health. So we don't wish to use that for enforcement, but the student code of conduct certainly gives us some latitude there to enforce the wearing of face covering.
Great, thank you. Well, we had one question from our audience about whether or not this recording is going to be available after this webinar. The answer is yes, we will make this recording available. It will be available on asu.edu/fall 2020. So you can find it there. And again, that's where you can find contact information to send additional questions in. We are approaching the end of our hour here. And so we wanted to leave you with one last slide that has contact info and just reminders about where you can submit additional questions and get additional information. So you'll see there on your screen if you've got questions about your courses, degree requirements, or class schedule questions, you can email provost@asu.edu. If you anticipate needing technology to support your learning experience this fall, you can also contact provost@asu.edu. It's important to note that we loan laptops and hotspots to students during the spring semester to make sure that they could continue their learning. That's important to us. We want to make sure that you have what you need. If you have questions about student services or campus life in general, there's an email address there, deanofstudents@asu.edu, or you can call 480-965-6547. If you have any questions about how we're maintaining our facilities, what our cleaning protocols are going to be, You can email bf-operations@asu.edu. And then if you're an admitted graduate student and you have questions, you can contact gograd@asu.edu or visit graduate.asu.edu. And this concludes our webinar for our returning students for the fall 2020. We want to thank you for joining us today. We really look forward to seeing you on campus this fall. We hope that this webinar was informative for you and beneficial. We tried to answer as many questions as we could. If your question wasn't answered, again, we will get information to you. And stay in touch, stay healthy, and live well, be well. Thanks, Sun Devils. We'll see you soon.